Okay, so we're going to discuss a uterine rupture and a traumatic brain injury, namely HIE or hypoxic ischemic encephalopathy. And HIE is a reduction in blood and oxygen, which can lead a baby to suffer a brain injury. A uterine rupture is exactly what it sounds like. It's when the uterus tears or ruptures. And this can occur. It can occur during pregnancy. It can happen during labor and delivery. And there can be a number of things which can cause a uterine rupture. But when a uterine rupture occurs, it is an emergency. It can be an emergency situation because one of the main concerns with the uterine rupture is hemorrhaging or bleeding. And remember, I said earlier that HIE is a reduction in blood and oxygen, which can lead a baby to suffer a brain injury. If mom has a uterine rupture and it is a bad rupture and there's a lot of bleeding, a lot of hemorrhaging going on, it would follow that if mom is losing a lot of blood, that can, in some instances, negatively impact the baby. And so when we are looking at these cases, when families contact us and their baby has suffered a traumatic brain injury like HIE and there may have been a uterine rupture, one of the things we're definitely looking out for is what was going on with mom. So let's say, for example, mom had a previous C-section and now mom is moving to a vaginal delivery. Although uterine ruptures that occur after a C-section, they don't happen a lot, but they can happen. And it's always important that you speak with your doctors and medical professionals beforehand about these types of issues as to whether you would be a good candidate for a vaginal delivery following a C-section. And so where sometimes we can see problems with these types of situations where a rupture occurs, it can be when mom is going through labor and delivery and things seem to be going okay, but let's say, for example, mom begins to have a prolonged labor and she's not moving, or she gets stuck in one stage or station. And so it's important for doctors and nurses to pay attention to these types of things and to what is happening not only with mom, but the readings on the electronic fetal heart monitor. So if you've got a prolonged labor that's going on and there could be signs of fetal distress, doctors and nurses, especially given mom's history, they have to be very careful in these types of situations. So I know I did talk about a lot tonight with this, but I just wanted to help you understand this uterine rupture and how a uterine rupture in some cases can lead to a baby suffering a traumatic brain injury like HIE. If you have more questions, feel free to pick up the phone and call me. There's a telephone number on the screen. Let my secretaries know, let them know that you would like to get on our calendar and pick a date and a time. That's important. A date and a time that will be good for you, and we can get you on the calendar and we can talk with you about your baby's situation. Remember, it costs absolutely nothing to talk with us about what's going on with your baby. This is what we do. We help families, or we help them try to get answers in regards to the cause of these types of traumatic brain injuries like HIE. One more thing before I get out of here. I practice law here in the state of Maryland, and I know this video is on the internet, it's on social media, and I can't control who's going to watch it and who's going to reach out to me. If you reach out to me and you are not in Maryland, understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work with you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you're not in Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.